Stan's going to talk about my colonoscopy diagnosis, and you got my specimens, right, in your lab, and you read the specimens because you...
I'm a pathologist, so I read pathology specimens all the time, and I did look at Cindy's polyps, and I see that she had two polyps, or two different types of polyps. One is entirely benign. It's called a hyperplastic polyp, and that's caused, we don't know what causes it, but some people think it's caused by injuries to the lining of the colon, and the cells try to regenerate. And so that has nothing to do with cancer at all. The second type is called a tubular adenoma, or adenomatous polyp. Now that one can be considered pre-neoplastic or precancerous. It doesn't mean it was going to become a cancer, but about 5% of these types will develop into cancers if they are allowed to grow. So it's always good to take these out. Now, Cindy's polyps were both very small, about 3 millimeters or so. It's very small. And going back to the tubular adenoma, it's best to take them out when they're small, easy to get out. Now, these types of tubular adenomas, they have genetic or chromosomal damage to them, and the cells, when they get this type of damage, they become resistant to death, and they proliferate in an uncontrolled fashion. So they grow and grow, and the polyp gets bigger and bigger. Now, if more or if certain types of genetic damage continues to happen, then those types of cells can become malignant, and then a cancer will grow, and that's bad. So it's good that they were taken out.
And now colonoscopies aren't 100% accurate?
They're not 100%. They're very good at catching polyps and early cancers even. But it depends on the skill of the colonoscopist. Some are better than others. Some take more time than others. They tend to take more time to look behind every fold or ridge within the colon. The colon is not like a smooth pipe. There's many ridges and bends and curves to the colon, so the colonoscopist has to be very skilled in getting around all the curves of the colon and making sure you look at every space, every hidden area. And so it depends on the skill of the colonoscopist.
And your brother died of colon cancer.
I had a brother, an older brother, that died of colon cancer. He had advanced colon cancer. He had never had a screening colonoscopy done. So when he presented to the hospital, he had symptoms of obstruction. He had advanced colon cancer, and it had already spread outside of the colon. So he had advanced colon cancer.
And I now have a family history of it as well.
Cindy has a positive family history, which means she may be at higher risk, not necessarily, but she may be at higher risk for developing colon cancer. So it's a good thing she's had her colonoscopy done at this time.
And relatively painless, and definitely preventative. And I'll be on the 5-year plan probably because of the second colon polyp.
Yeah, the tubular adenoma. If you have one tubular adenoma, you're at probably higher risk of developing another type of similar polyp that might be precancerous. So it's best to be re-examined after a specified period of time. 5 years sounds pretty reasonable for something like this. 3 to 5 years, and the doctor will help determine what the interval will be.
And how many colon cancers do you see every year? Quite a few?
I see, well, let's put it this way. St. Joseph Hospital and Humboldt Central Lab, we probably diagnose close to about maybe 80 to 90 colon and rectal cancers per year. So we see, and I see most of those. So we're talking 2 a week, almost two a week. So it's not uncommon here in Humboldt County. That's normal that's a normal frequency for this population.
And these people have been screened or unscreened?
No, this is all comers. This is people, a combination of screened and unscreened patients.
Mm-hmm. And if it's caught early, this cancer is fairly preventable?
Oh, they're all almost preventable if you catch them early. Yeah, if you catch them in the polyp stage, they're not even cancers. So this is not a cancer. Let's go back over this. This is not a polyp. Is not a cancer. There's no cancer here. What we're trying to do is take out lesions that are at risk for developing cancer. So there was no cancer in either of these polyps.
Mm. And so if you do have cancer of the colon, you remove a segment of the colon and go on with it?
If it's early stage, yes, you take a segment of the colon, take out all the colon cancer that you can get, and see if there's any lymph node involvement.
Okay, well, thank you for doing this, and thank you for, I guess, reading my, what a great marriage.
Okay, good.
At least you didn't read them before I had them taken out. That was a joke.
Yeah.
All right. Bye.
Bye-bye.